It was sold as the pill to treat flu symptoms and prevent the spread of this infectious disease. Canada believed in the effectiveness of Tamiflu and stocked up on the drug. Now, an international study has found the drug doesn't work as well as first believed. Francis Savaggio reports.
This little pill was supposed to be the weapon against the spread of the flu. In the wake of SARS and avian flu, World Health officials were desperate to stop similar outbreaks in the future, and Tamiflu seemed to be exactly what the doctor ordered.
The World Health Organization looked at it quickly and said, hey, this looks like a good answer. Everybody should stockpile this.
Tamiflu was pitched as an effective way to treat flu symptoms and prevent the spread of the disease. It became the backup plan for health agencies around the world, including Canada. But a newly published study suggests it may have been a huge waste of money.
I think we can now say that we've been given an over-optimistic view of the drug. It doesn't do most of what we were told it did.
Now, it's not like the drug doesn't work at all. Researchers say if you take it within the first couple days of feeling the symptoms, you may be able to reduce the length of time you're sick by a little less than a day. Aside from that, the study says it has a little more effect than aspirin or acetaminophen.
Well, what we found importantly about these drugs is that they don't reduce complications, important ones such as pneumonia and hospitalization. Second is we found that they don't actually prevent the transmission of flu. And then third, more worryingly, that they have a number of adverse effects.
But the company that makes Tamiflu insists the drug is fine.
Roche completely stands by the data that's been used and reviewed by regulators to approve Tamiflu in more than 100 countries around the world for both the treatment of flu and for the prevention of people contracting flu.
Canada's Public Health Agency says it also remains confident, but flu experts like Dr. James Dickinson say more research is needed.
Would you take a drug that maybe has some effect? It's an expensive drug and it's going to cause side effects. Do you need that?
For now, that's a decision that will be left to each patient. Francis Savaggio, Global News, Calgary.